What is dissociative identity disorder, DID? Dissociative identity disorder, DID, previously known as multiple personality disorder. It is a mental health condition characterized by the presence of two or more distinct identities or personality states that recurrently take control of an individual's behavior, thoughts, and emotions. People with DID may experience gaps in their memory or feel detached from their thoughts, feelings, and actions, as if they are observing themselves from the outside. These symptoms may be triggered by traumatic events, such as physical or sexual abuse, emotional neglect, or severe accidents. The diagnosis of DID remains controversial, and there is ongoing debate among mental health professionals about its validity. However, for those who do receive the diagnosis, treatment typically involves psychotherapy and may include medication to manage co-occurring mental health conditions, such as depression or anxiety. What are the different types of dissociative disorders? There are several types of dissociative disorders recognized by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, which is the standard classification of mental disorders used by mental health professionals. Dissociative Identity Disorder, DID. As mentioned earlier, DID is characterized by the presence of two or more distinct identities or personality states that recurrently take control of an individual's behavior, thoughts, and emotions. 1. Dissociative amnesia. Dissociative amnesia involves the inability to recall important personal information, usually related to a traumatic or stressful event. This type of amnesia is not due to a neurological or medical condition. 2. Depersonalization/derealization disorder. Depersonalization involves feeling detached from one's own body, emotions, and thoughts, as if one is an observer rather than a participant in their own life. Derealization, on the other hand, involves feeling disconnected from the external world, as if everything around is not real. 3. Other specified dissociative disorder, OSDD. This category includes dissociative disorders that do not meet the full criteria for any of the other specific dissociative disorders, but still cause significant distress or impairment in social, occupational, or other areas of functioning. 4. Unspecified dissociative disorder. This category includes dissociative disorders that do not fit into any of the other categories, or are not specified in enough detail to diagnose a specific dissociative disorder. How common is DID? The exact prevalence of dissociative identity disorder, DID, is not well established, as it is a relatively rare and complex mental health condition. However, some studies suggest that DID affects approximately 1 to 2% of the general population, with higher rates reported in clinical populations, such as individuals with a history of childhood trauma or abuse. Diagnosis. It is also worth noting that the diagnosis of DID remains controversial, and there is ongoing debate among mental health professionals about its validity. Some experts believe that DID may be overdiagnosed due to the influence of media and popular culture, while others argue that it is underdiagnosed due to a lack of awareness and understanding of the disorder. Overall, the prevalence of DID varies depending on the population studied, the diagnostic criteria used, and the cultural and social factors that may influence the expression of dissociative symptoms. What are the signs and symptoms of DID? Dissociative identity disorder, DID, is characterized by the presence of two or more distinct identities or personality states that recurrently take control of an individual's behavior, thoughts, and emotions. In addition to the presence of alternate identities, individuals with DID may experience the following signs and symptoms. 1. Gaps in memory. People with DID may experience memory loss or gaps in their memory related to specific events or periods of time, which can vary in length from minutes to days to years. 2. Dissociative symptoms. Individuals with DID may experience a range of dissociative symptoms, such as feeling detached from their own thoughts, feelings, or body, or experiencing a sense of unreality or detachment from the external world. 3. Mood and behavioral changes. Changes in mood, behavior, and affect are common in DID. For example, one identity may be angry, while another may be fearful or anxious. 4. Self-injury or suicide attempts. Some individuals with DID may engage in self-injurious behaviors, such as cutting or burning themselves, or may have a history of suicide attempts. 5. History of trauma. DID is often associated with a history of childhood trauma, particularly physical or sexual abuse, neglect, or emotional abuse. 6. Co-occurring mental health conditions. People with DID may also experience other mental health conditions, such as depression, anxiety, or post-traumatic stress disorder, PTSD. It is important to note that these symptoms are not exclusive to DID and can also be present in other mental health conditions. A thorough evaluation by a mental health professional is necessary to make an accurate diagnosis. Who is at risk for DID? The development of dissociative identity disorder, DID, is strongly associated with exposure to severe or chronic trauma, particularly during childhood. Children who experience physical, sexual, or emotional abuse, neglect, or other forms of trauma are at higher risk for developing DID. Other factors that may increase the risk for DID include 1. Early onset of trauma. Trauma that occurs at an early age, such as before the age of 6, is associated with a higher risk of developing DID. 2. Severe and chronic trauma. The severity and chronicity of trauma are also important risk factors for DID. For example, individuals who experience repeated or prolonged abuse or neglect are at greater risk for developing DID. 3. Lack of social support. A lack of social support or a stable support system may contribute to the development of DID in individuals who have experienced trauma. 4. Vulnerability factors. Certain personality traits, such as a tendency to dissociate or high levels of suggestibility, may increase the vulnerability of an individual to developing DID. It is important to note that not everyone who experiences trauma will develop DID, and other factors, such as genetic, environmental, and cultural factors, may also play a role in the development of the disorder. The exact causes of DID remain unclear, and further research is needed to fully understand the risk factors and mechanisms underlying the disorder. How to recognize dissociative identity disorder and its associated mental disorders. Recognizing dissociative identity disorder, DID, and its associated mental disorders can be challenging, as the symptoms can be complex and varied. However, some signs and symptoms to look out for include 1. Gaps in memory. People with DID may have difficulty recalling important personal information or events, especially those that occurred during periods when an alternate identity was in control. 2. Changes in behavior or mood. Individuals with DID may exhibit sudden changes in behavior or mood that are difficult to explain, such as becoming agitated, fearful, or aggressive for no apparent reason. 3. Identity confusion. People with DID may experience confusion about their identity, such as feeling as if they have two or more distinct personalities or identities. 4. Hallucinations or delusions. Some individuals with DID may experience hallucinations or delusions, such as hearing voices or seeing things that are not there. 5. Dissociative symptoms. Dissociative symptoms, such as feeling disconnected from one's thoughts, feelings, or body, or experiencing a sense of unreality or detachment from the external world, may also be present. 6. Co-occurring mental health conditions. People with DID may also experience other mental health conditions, such as depression, anxiety, or post-traumatic stress disorder, PTSD. How is dissociative identity disorder diagnosed? Dissociative identity disorder, DID, is typically diagnosed by a mental health professional, such as a psychiatrist, psychologist, or clinical social worker, who has experience in working with dissociative disorders. A comprehensive diagnostic evaluation will include 1. Clinical interview. A mental health professional will conduct a clinical interview to gather information about the individual's symptoms, personal history, and any possible traumatic experiences that may have contributed to the development of DID. 2. Psychological testing. Psychological tests, such as the Dissociative Experiences Scale, DES, may be used to assess the individual's level of dissociation and other associated symptoms. 3. Observation and assessment. A mental health professional may observe the individual's behavior and mood, as well as conduct a thorough assessment of their cognitive and emotional functioning. 4. Diagnostic criteria. The diagnostic criteria for DID, as outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, will also be considered during the evaluation. In order to be diagnosed with DID, an individual must meet the following criteria. A. Presence of two or more distinct personality states or identities, each with its own way of perceiving, thinking, and relating to the environment. B. Recurrent episodes of dissociation, during which one or more alternate identities take control of the individual's behavior, thoughts, or emotions. C. Inability to recall important personal information or events that are inconsistent with ordinary forgetting. D. Symptoms cause significant distress or impairment in social, occupational, or other important areas of functioning. It is important to note that DID is a rare and complex disorder, and a proper diagnosis should only be made by a qualified mental health professional after a thorough evaluation and assessment. What other psychiatric illnesses might occur with DID? Individuals with dissociative identity disorder, DID, may also experience other psychiatric illnesses in addition to DID. The most common co-occurring mental health conditions that have been found to be associated with DID include 1. Post-traumatic stress disorder, PTSD. PTSD is a common co-occurring condition with DID, as both disorders are often the result of trauma. People with PTSD may experience flashbacks, nightmares, and avoidance behaviors related to a traumatic event. 2. Depression. Depression is a common mental health condition that can co-occur with DID. People with depression may experience persistent sadness, loss of interest in activities, changes in appetite and sleep patterns, and difficulty concentrating. 3. Anxiety disorders. Anxiety disorders, such as generalized anxiety disorder, panic disorder, and social anxiety disorder, can also co-occur with DID. People with anxiety disorders may experience excessive worry, fear, or anxiety in social situations or in response to specific triggers. 4. Substance abuse. Individuals with DID may be at an increased risk for substance abuse or dependence, as a way of coping with the distress and trauma associated with the disorder. 5. Borderline personality disorder, BPD. BPD is a personality disorder that is often associated with a history of trauma. People with BPD may experience mood swings, impulsivity, and difficulties with interpersonal relationships. Are there famous people with dissociative identity disorder? There is limited information available on famous individuals who have been diagnosed with dissociative identity disorder, DID. As the disorder is a highly stigmatized and often misunderstood condition, many people with DID prefer to keep their diagnosis private due to concerns about stigma and discrimination. That being said, there have been some cases in which public figures have spoken publicly about their experiences with DID. For example, in the 1970s, a woman named Sybil Dorset, a pseudonym, gained widespread media attention after her therapist, Dr. Cornelia Wilbur, wrote a book about her experiences treating Sybil for DID. The book was later adapted into a made-for-TV movie called Sybil, which aired in 1976 and starred Sally Field in the title role. More recently, the singer and actress Trudy Chase, who passed away in 2010, wrote a memoir called When Rabbit Howls, which detailed her experiences living with DID. Other notable individuals who have publicly discussed their experiences with dissociation include Roseanne Barr, who has stated that she experiences dissociative episodes as a result of trauma, and Herschel Walker, a former NFL player who has spoken publicly about his experiences with dissociation and has been diagnosed with DID. It is important to note that the experiences of individuals with DID are unique and personal, and no two cases are exactly alike. While some individuals may choose to speak publicly about their experiences with DID, others may choose to keep their diagnosis private. What is the treatment for dissociative identity disorder, DID? The treatment for dissociative identity disorder, DID, typically involves a combination of psychotherapy, medication, and supportive care. The goals of treatment are to help individuals with DID to integrate their identities, reduce dissociation, and manage any co-occurring mental health conditions. Psychotherapy is the primary treatment approach for DID and can involve various modalities, such as cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and eye movement desensitization and reprocessing, EMDR. Therapy may focus on addressing the traumatic experiences that led to the development of DID, developing coping skills to manage dissociation and stress, and working towards integrating identities. Medication can be used to manage co-occurring mental health conditions, such as depression, anxiety, or mood disorders. Psychotropic medications, such as antidepressants and antipsychotics, may be prescribed to help alleviate symptoms. Supportive care. Individuals with DID may benefit from supportive care, such as occupational therapy, vocational rehabilitation, and case management, to help them manage daily activities and improve their quality of life. Family therapy may also be helpful for individuals with DID, as it can provide support and education to family members about the disorder and help them understand how to support their loved one's recovery. Can hypnosis help with DID? Hypnosis is a controversial topic when it comes to its use in treating dissociative identity disorder, DID. Some therapists use hypnosis as a tool to help patients access and explore traumatic memories that may be contributing to their dissociative symptoms. However, there is no conclusive evidence that hypnosis is effective in treating DID, and some experts warn that it can actually worsen dissociative symptoms in some cases. One concern with the use of hypnosis in treating DID is the potential for suggestion and false memories. Individuals with DID are highly susceptible to suggestion, and hypnosis can increase suggestibility, potentially leading to the creation of false memories or the reinforcement of inaccurate beliefs about the self or the past. Additionally, some individuals with DID may experience a loss of control during hypnosis, which can be distressing and can trigger dissociative episodes. Therefore, it is generally recommended that hypnosis be used with caution and only by trained professionals who have experience in treating DID. Therapy for DID typically involves other approaches such as talk therapy, cognitive behavioral therapy, and EMDR, which have been shown to be effective in treating the disorder. Ultimately, the treatment of DID should be individualized to meet the unique needs of each patient and should be based on evidence-based practices. Can dissociative identity disorder, DID, be prevented? There is no known way to prevent dissociative identity disorder, DID, from developing, as it is typically a response to severe and prolonged trauma that occurs during childhood. However, early intervention and treatment for children who experience trauma may help to prevent dissociation and other negative outcomes. For example, therapy for children who experience trauma can help them develop coping skills and increase their resilience. Supportive relationships with caring adults and access to mental health services can also be helpful in promoting healthy development and reducing the risk of dissociation. Additionally, creating a safe and stable environment for children who have experienced trauma can be helpful in reducing the severity of their symptoms and decreasing the risk of dissociation. This may involve providing a safe and stable home environment, promoting healthy relationships, and addressing any environmental stressors that may contribute to the child's trauma. While DID may not be preventable, early intervention and appropriate treatment can be effective in managing symptoms, improving overall functioning, and reducing the risk of negative outcomes associated with the disorder.